Hello, my name is Nathan Shane. I am a respiratory therapist here at Powell Healthcare, and I'm just going to take you through some of the testing that we can do in this pulmonary functioning lab here. The first test that I'm going to go through is done on this machine here, and it's called a simple spirometry test. This is primarily done for firefighters or some different lines of work, places at the manufacturing plants and places like that. I'll do this kind of on a yearly basis, just a real basic look at how well you can ventilate, which means how well you can breathe the air in and how well you can blow it out. So that's a really simple one there. The next one we commonly do is called a pre and post bronchodilator test, which we see a lot of people that have COPD, which is the chronic obstructive pulmonary disease, emphysema, chronic bronchitis, bronchiectasis, these different lung diseases. And this testing we do the same as the spirometry test. So we test how well they can breathe in and how well they can breathe out. With this test, after that test is done, we do a bronchodilator, which is typically albuterol. And then after that medication takes effect, we repeat the same test. So that way we can see if it's reversible, so more on the asthma side of it, or track how bad the COPD is or the emphysema is. The third test that we can do, once again, just on these machines here, is called a DLCO test. And that's a diffusion capacity test. We've seen this a lot in post-COVID patients with emphysema, and some with the vaping problems that we've seen too. It affects how well the gases actually travel across the lungs and able to get into the bloodstream and go to the rest of your body. Real simple test on here that can be added into the testing with the pre and post bronchodilator. And the final test is what we can see here in this fun looking telephone booth, and this is what's called plethysmography. And with this one, it can fully measure the total lung capacity of your lungs. So when you normally breathe in and out, even if you breathe out as hard as you can, you still have some reserve volume left in the bottom of your lungs. So all this testing over here can test the vital capacity of your lungs, but not the last little bit in there. So that's where this comes into play, and we can use this to track how much air or how little air is in your lungs. So if we have a restricted disease, we can see how little actual liter volume you have in this. Also, if you have COPD, emphysema, anything that's going to cause some air trapping, we can also see that in here. Physicians are able to order these tests relatively easily. If they want all of them, they can order as a full PFT, sometimes called a complete PFT. We can do all of these tests within an hour and usually get it back to the provider the same day that we do these. Currently, we do this testing every Thursday from 8 a.m. to 12. If need picks up, we can create more days for it, but currently that's what we do. And we'd be happy to have you in here. And once again, this is just kind of a brief overview of what we can do. But we look forward to serving you in our community.